everyone, I am Dr. Sudakshina and I am the Training Center Chief of Chettinad Simulation and Skills Center. And with us we have Dr. Rohini ma'am, who is a professor of OBG in our institute. And today we are having a virtual simulation hands-on session. And ma'am had just now experienced a small part, one of the modules of NMC certifiable skills. Now NMC certifiable skills are compulsory and we have to train them, our MBBS undergraduate students, these clinical skills, and this is being conducted today as a workshop in virtual reality. So ma'am, we want a few words from you. Like how was it and what is the skill you practiced now in virtual reality and how you felt about it. So if you can share your views.
Thank you, Dr. Sudakshina. It was a wonderful experience altogether, and I thank the institution also for providing the opportunity for the faculty first to familiarize themselves with this new modality of treatment, of teaching undergrads, MBBS students. And I think it would be a very useful tool to train the students. First of all, being virtual reality, I think students are already familiar with this mode of digital methodology because being the younger generation, they are very familiar with it. So it will not be very new for them to pick up these skills. And it will hold their interest also basically. So they will find it much better than a classroom experience which may be more dry, and I think it will be more challenging for them to try and learn the skills and do it at the proper time. So today I was shown 2-3 modules. One of them was how to do a catheterization on a male urethra, and the second one was how to take out a ECG printing. Both were fantastic. I must say a lot of thought has gone into this whole concept and execution by a brilliant team of, I'm told it is designed by a doctor and even engineers,
and all from India.
And all from India.
Correct.
And
So
I was really very proud to know that it is a really world-class product. And it will be very useful to students.
Yes, because they'll be very excited because now the new generation wants to do everything in the virtual world.
Exactly.
So
also we have this facing this problem of patient cooperation.
Yes.
To show even bedside teaching.
Yes.
So
and the morality and the ethical issues.
Exactly. And the students, being students and younger generation, sometimes they forget themselves how to conduct themselves in front of a patient when we're taking classes. So if they can be taught all this in the virtual reality and they are confident about doing it, then we can in the next phase expose them to patients as they become CMRIs and they come for post graduation also. It will be very, very familiar to them.
Correct.
So,
definitely.
So I found that whole thing was very user friendly.
Yes.
That was one thing.
Yes.
And
it takes some time to get used to it because your eyes are closed and you are into that virtual world with the helmet and the hand pointer and which switch to go up, go down, because they have everything step by step.
Exactly.
And you are not missing any steps.
Everything
like if you
comes
miss
out.
a step, it is telling.
Yes, it prompts you that you have to go back.
Yes.
And it does not allow you to go to the next step before you complete one particular action.
That is
properly.
very important because most of the time, even when we are doing physically with the mannequins, we may miss the steps as a teacher also.
Exactly.
So that one point is we take aseptic precaution, we wear the gloves, everything is done step by step and correctly.
Yeah, you're very right.
That I felt that this is a very good mode of teaching to the students, and they also learn it correct way. The proper standard operating procedures, basically the SOPs are so correct.
Very nicely designed, I must say.
Yes.
And also, I believe that there is a facility there to evaluate the student, where these pop-ups will not come, and the student can do it himself or herself, and then the scoring will come. And the machine or the virtual reality system will not allow the student to I mean, in the training model, it not allow the students to go to the next step.
Correct.
But during assessment, if they does it wrong, then
Then
feedback will
there's
be
only
given.
scoring it,
Yeah,
yes.
the feedback will be given.
So it is a
student
more
gets
objective way of scoring, and
Exactly.
there is no teacher bias
in that.
available.
Yeah, very true. That's a very good point you have brought out.
Mm-hmm.
So it will be very, very good way of evaluating exactly what they are doing.
Correct.
And second point is also that the time management. The students will also know that he has to be
Yes.
quick to do it, and that will automatically get inbuilt in the training. I
Too much of time is not given to each step.
Yeah.
So that they don't get lost and all those things. So I
Exactly.
think that way. Very nice, ma'am. Thanks for having the feedback from you.
Thank you.
And we really like it. The way you have explained it, it is very nice. And we look forward, and we want all your faculty members and your HOD ma'am, everybody to come and have an experience
Sure,
over here.
definitely.
So we are there even tomorrow also. So it will be, they are there. So it will be great for them.
Definitely. I think it's a wonderful tool, and it's a great opportunity for the students that the management has provided, and you're doing a real great job of
Thank you so
coordinating the whole thing.
Thank you
Thank
so
you for
much.
the invite.
Thank you so much.
Thank
ma'am.
you.